My experience began with the orthopedic department. I had 2 knee replacement surgeries. They are one of the top-notch rehabilitation facilities that I've ever known. Everybody is so patient and kind, and if you have a problem or a question, they'll find an answer or help find a solution.
The most common condition we see is typically degenerative joint disease of the shoulder, hip, and knee. We treat these conditions with a number of non-surgical modalities such as activity modification, physical therapy. Sometimes we'll treat these conditions with medications to help with local pain control and inflammation. If these modalities are not effective, we then discuss surgical treatment options, and those can be varying from hip or knee arthroscopy to typically more along the joint replacement procedures.
The situation of having surgery begins with Heather and ends with Heather. And Heather is the person who coordinated everything for me.
I would say the most important thing about my job would be that they have that connection to somebody. You know, it's not always easy to get a hold of your surgeon, especially because he's busy seeing patients, he does surgery. They're almost always able to contact me. So I think that that's probably one of the biggest things that I get from patients, that they just loved being able to get a hold of me and knowing that they could get the answers that they needed.
What I really enjoy about my job is when we go through the surgical process and we actually get them back and we see them in the recovery phase and we see them actually being able to partake in some of these activities that before they weren't able to do. And sometimes even before their surgery, they come in saying, I really want to be able to do a 5K. And it's really satisfying for us to be part of that process and then see them 3 months afterwards and saying, hey, I got to do my 5K.
From the scheduling to the dismissal, a lot of people are involved in between. They were so kind and did all that they could to make this a good experience.
I want patients to feel like they are the most important patient at any given time that I am interacting with them. So even though I have many patients, I have things to do throughout the day. When I am talking to that patient, I want them to feel like they're number one.
We have a great team here, and I think that's the main feedback we get from patients, is that they feel taken care of. There's no concern too great or too small that I feel that we can't address, and that's our goal, is to just take good, comprehensive care of patients.